Against Children survey, this was conducted in 2019. It proved to be a very, very useful tool. I must say that this is a second one that we've had in Kenya. We were lucky enough to be one of the countries where we had a repeat exercise. And right from the start of the Violence Against Children survey, at least the findings are able to give us the difference between the previous one, 2010 and 2019. So be able to get that picture. Has VAC actually reduced, or what is happening to VAC? But this one particularly was interesting for me because I was part of the protocol writing right to implementation and report writing. What it was able to define is, number one, who are most affected in terms of age set, in terms of sex, between boys and girls in Kenya. Number two, it was able to clearly define the context under which violence occurs in Kenya. And this is within the home setup, in the community, and within the schools, as children are out in the playground. So we're able to get a very clear picture of where this violence against children acts tend to occur, particularly sexual violence, which is the most atrocious type of them all. So it was able to give us a very, very clear picture of where this violence occurs, right to what time of day this violence occurs, who the perpetrators are that do this to our children in Kenya. And then the third component that it was able to give us. So the first one was the prevalence of violence in Kenya, how badly it affects our children. The second was the context. The third was how responsive are our health services, and not just for health, but our multi-sectoral services. So this is the social and welfare sector. For the police, how responsive are they to child survivors of violence to go to seek services from them? What I found fascinating about this is, as adults in the policy world, as researchers, we always have this way of thinking of how violence occurs. But the unique thing with the VAC survey was it was at population level, and it's the children who are actually reporting what their lived experiences and what they go through in their day-to-day life by the questions that we were able to ask. So that really, at least from our perspective in Kenya, it opened our eyes to some of the assumptions that we might be making towards the services that we provide for children versus what the children actually say about these services. So it was able to give that very, very clear picture of what children under 18 are going through in Kenya. And the best thing about understanding what they go through is that now the next level would be coming up with very responsive care package for them, either towards reducing the vulnerabilities that they're going through or responding to their needs for those ones who have unfortunately gone through that event. So the VAC survey was able to give us that clear picture. And of course, the comparison, being able to see whether VAC declined, VAC increased between the first VAC survey and the second 2019 one. And the important thing again about this VAC survey and that comparison is that we were able to see what efforts the government put in to be able to see the reduction. Because like in our case, we actually got a reduction in VAC overall, and even by the types of violence. So this second one was important in us, appreciating that as implementing partners, that as the government, that as development partners and the investment that has been made into it actually made a difference for the children by the proportion or by the prevalence that was reported in the second VAC. I think there's been conversations going on, particularly at community level, about child protection. This is just community coming to the awareness that children need to be protected. After all, we say children are the future. So if you do anything to them right now, even we as adults in the community, we appreciate that that has an impact on them. So there's been a change at community level, being aware of what violence against children is. Not that we have reached that point where we understand it, what VAC is. There's still a lot of mobilization, but nonetheless, people are starting to appreciate that there is something called violence against children within that period. Also within that period, there was investment by the government. There were certain acts, whether the Children's Act, that the implementation of them started to become obvious in some sectors that we were saying. I may have mentioned like health services, albeit there being gaps. There were important standard operating procedures that were put in place that addressed child survivors. You had policies that ordinarily were very adult-centered in terms of caring for survivors for adults. But now there was the deliberate inclusion of children in those documents as well. And once that is being mentioned in policy, it will definitely have an impact towards resource mobilization for actions that protect children in our country. Let me start off by saying that in this phase of us working towards ending violence against children, I think one of the best things that we've done in Kenya is we've been able to look at the evidence that is there in terms of strategies that work towards ending violence and adapted them in our national response plan, prevention and response plan towards ending violence. So just starting off with that plus point, that we have a document that is evidence-based and advocates for evidence-based strategies. Now, some of the challenges that we have is the implementation of this document. Right now, with the support that we are having from URC and USAID, it's allowing us to go out to the counties where we are going to as LVCT Health in consortium with other partners, to be able to tell the policymakers at county level that we have this document that has evidence-based strategies. So we've done half the work, that these are things that for sure, if you're able to adapt and implement, it will definitely lead to a reduction towards violence. However, the implementation of this does require resources, and we work in a resource-limited country. So you might find even the impact that we have with this money is not big enough to cause that systemic change where we know it will lead to zero. It will certainly lead to some level of decrease in the prevalence, but just not enough to be able to say we've completely eradicated violence against children. So from a policy perspective, the documents are there, implementation is what can become a challenge. And the unique thing about violence against children and its prevention is that it's a multi-sectoral thing. Health sector has a role to play, the judiciary has a role to play, the social welfare has a role to play, the children's department, the treasury, because all these things need to be financed by the government, at least to be able to see that effort is being put towards it. Bringing everybody together on the same page can prove challenging sometimes, but we do have solutions like technical working groups, so we do a lot of deliberate advocacy to make sure that all these key people in all those sectors understand the impact of VAC, for them to be able to believe enough in putting resources towards it. So resource mobilization is another thing. The first is implementation of this plan that we have, very, very elaborate plan that is evidence-based. The second one is the resource mobilization. Obviously, that ties into its implementation. If the resources are not there, then it impacts the implementation. The third thing is that from my perspective, how I see it, we are a reactive country. And what I mean by that is until an event occurs is when we invest in it. So there's still a lot of work I want to believe that we have to do, even in terms of changing the service providers, changing the policymakers' perspective, to be more on prevention rather than curative. The whole idea with NPRP is we do not want it to happen. We do not want violence against children to happen. And that's why all those strategies, or most of those strategies, are all about prevention. But then we are working in a system where, even in terms of resource mobilization, it's curative. It's about once the event has happened, how then do we handle it? And now with all the research that has been done, we realize that being on that part of the scale is more costly than actually preventing the violence from happening. So there's a lot of mindset changing, value clarification that we need to do right from the policymakers' perspective to we, the implementers, even to the community, where you don't want cases of violence against children being reported to the chief. How about we prevent it from happening? And the NPRP, that's the National Prevention and Response Plan for Kenya, is there to be able to guide people in terms of actions that they can take to change it. So that's the third thing. We are very curative rather than preventive. And I think for us to have that impact on the prevalence, we really need to change how we see things and be more prevention focused.